We're back, and now we'll talk about how to treat cysts about the hand and wrist. But because they're harmless, you can leave it there if you want. It's not going to do any damage. But a lot of people do have problems with them, and they ask us for alternatives. All right, and some of these can be drained. Okay, they're fluid filled, remember. So we'll offer on a lot of them, depending on where they are, to stick a needle in them and collapse the cyst. A lot of times they're going to come back if you do that, but sometimes they won't. So that's why that's a reasonable option to at least try for some patients. Also, sometimes we take them out in the operating room. But when you take them out in the operating room, remember what I said. You can't just lop it off like a daisy. You have to follow it down to the root, the stalk, and get it from its origin. So that means we got to find the cyst and take it off at the joint level. In other words, we have to go deep. We're not going to hold you down in clinic and do that. That's something we do in the operating room. And also the ones that are inner palm that can emerge. Similarly, you go down to the flexor tendon sheath, and we'll usually excise those in the operating room. The reason we excise them is the recurrence rate. It's not zero, they can come back, but the recurrence rate is much lower if you take them out in the operating room. And that's usually an outpatient procedure and usually not done under general anesthesia. There's various forms of sedation and local anesthesia or creative blocks that anesthesiologists do, so patients don't have to be put all the way to sleep. Afterwards, what happens depends on where we take it from. If it's from your wrist, we usually splint you at first and immobilize you just until you come back, usually in about a 10 to 14 day window, or we stretch it out until about a 3-week window, depending on where the origin of the cyst. And then we let patients start moving, but everybody's a little gimpy at first. They're sore, you've been holding you still, you're weak, so it takes most folks about a month before they start getting confidence. So if you have any problems if you have any lumps like this that come up on your hand, they're really common. If you haven't had it, somebody in your family probably has. You're welcome to come see us, myself or Dr. Cassidy, at Colorado Springs Orthopaedic Group at 719-632-7669. Have a good day.